So just real quick, who in here has heard of Kratom like 5 years ago? Did anyone in this room? Okay, so maybe you're all just advocates and we're here just talking to ourselves. No. So I'm gonna start my clock, and I am very grateful to be here today and talk about Kratom use clinical trends in the United States. Disclosures: I am an assistant professor at Johns Hopkins. I came there by way of NIDA's intramural research programs to the National Institute on Drug Abuse, where I'm very thankful I had a wonderful postdoc experience. I have served as a paid scientific advisor to the International Plant and Herbal Alliance and the Kratom Coalition. I want to be very clear that the views that I express today are my own. I do not speak for Johns Hopkins School of Medicine, even though I do work there. So what is Kratom? Dr. Volkov has given my talk for me, so I will just keep this very simple. And I do want to highlight something that may not get brought up unless I flag it, which is that we see these beautiful pictures of these leaves, these green leaves, right? That is what's been used in Southeast Asia, Malaysia, Thailand for a very long time. That is not what is used in the United States. So when you see the stock photos of that, that is really not what kratom in the United States is. And I think it's really important to make that distinction. The complexity of kratom has already been discussed. Dozens of alkaloids just in the leaves. And those fresh leaves that are used in Asia are not what we're using here. You see this rainbow of different products that have proliferated, again, with varying concentrations and without any regulation, which is why we're here today. And so I think to understand, if you don't know anything else about kratom and you leave here today, when we say kratom, we are talking about dozens of things. And it's very difficult to study real world kratom use because, again, the measurements differ and the products differ. And so we do have a lot of work ahead of us to understand this. So please understand that variability. Um, and again, my colleagues and myself have written recently about this. You know, the marketplace has been called the Wild West, and I think that that's an apt characterization because we really do not have FDA or the industry or scientists really coming together in a coordinated effort to try to move forward clarity and science and also some common sense, legislation. And I think that headlines like this, media stories calling attention to the marketplace are going to increase in the coming years. Um, so when did this show up in the US? About 2007. So likely people were using it before then. However, we really did not have any clinical footprint of this until 2007 among chronic pain patients, people on opioids using for pain and then trying to either attenuate opioid withdrawal or substitute opioids. Since then, and as Dr. Volko touched on, and really, we have all-time multiple epidemics. So suicide, again, all-time high this past year. The drug, a polydrug epidemic, not just opioids, but stimulants, alcohol, raging, along with chronic pain and psychiatric distress. And so our treatment systems are beyond maxed. They've been beyond maxed. And even though we do have evidence-based treatments for some things like opioid use disorder, not everybody has equal access to those. And I believe it is not a coincidence that kratom did emerge in the United States as a lot of different prescribing guidelines were changing and as these epidemics were reaching, a climax, which were exacerbated during the COVID-19 pandemic. So I don't think, and a self-report that has been NIDA funded, data have supported this idea that people turned to this weird plant from another country, because they were desperate. And I came to know about kratom in 2015. I was doing an addiction or a clinical practicum in an addiction treatment setting. I had a client who came to me and he had been on Oxycontin. This is in central Kentucky, and he had about 6 months sober. And he said, I've started using this thing called kratom. And I'm like, what on earth are you talking about? And I thought it was a synthetic drug. And he was like, no, 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 it's a plant. And it helps me with my craving for opioids. And my anxiety is decreased and I feel good, but I don't feel high. I'm like, who cares? Like, this is kind of boring. And I've said this before. I'm like, it's in some ways kind of boring. And I honestly did not realize the clinical significance of what this young man had told me. However, in my many years of volunteer work in Kentucky, continue to meet other people who were in early recovery or trying to get into recovery and who had turned to kratom, many of whom, and I can verify this as firsthand, I've known they take kratom daily, but they are not using the substances that they were addicted to anymore. I'm not making a causal claim. I'm not saying kratom saved their lives. I have no idea. All I know is that they believe that it was helpful for them in their recovery journey. And again, we need more controlled studies to substantiate this. But right now, I do think we have a lot of self-report that is converging towards the same end. And so who now in 2023, who is using and why? We know most people are in their mid to late 30s on average, a really even split between males and females, vast majority non-Hispanic white, at least a high school degree, almost exclusively, and some very advanced degrees. So we have a very wide range of socioeconomic status here, including income, education. Some have been using, maybe just started a month ago, but in our NIDA funded work, we have had people using it 16 years. So there are people on, I would say most Kratom consumers in the United States have been using for many years, those who are regular consumers. And of course, this is America. So if you're using one thing, you are using another thing, right? Whether it's over the counter substances or prescriptions, which again could be very potentially dangerous, antidepressants, antipsychotics. In some recent work that we did, actually, I should say that among consumers using whole plant products, we actually didn't see a lot of illicit drug use contemporaneous to kratom use. Now, that doesn't mean there aren't these people doing that, because there are clearly, and we do have these fatalities associated with that polydrug exposure. But in our sample, it was actually a little bit boring in terms of what people were taking, and those data will be coming out in the near term. And again, among people who are using, most are using whole plant products. Some are absolutely using extracts, and I know it's a big part of the market. But again, I have studied mostly people using a whole plant material, and they're taking it 2 to 3 times per day on average. We've heard about harm reduction. So all of these here, which again, I've presented publicly, what you see are dozens of motivations for use. And what I want to draw your attention to, we've talked about, opioid withdrawal, attenuation, things like that. A lot of people are also using just to kind of improve their quality of life, improve their mood. And really, I don't think kratom gets enough attention for the stimulatory effects that it produces, right? So as has been discussed, we have people using for analgesia, but to the person, and I have talked to people at length, it is this combination stimulatory effect. People are taking this to try to be productive, increase energy, improve stamina, do triathlons. I kid you not, get on the Peloton and ride their bike. So this is not something that is, I want to take this and nod out, for lack of a better word. This is a very complicated, kind of weird plant, and people are reporting using it for many reasons. And you see this here. So these are like, again, I'm not showing a lot of data because they are not published. So I just want to kind of give a nod to the fact that we are increasingly aware of these proximal or immediate drivers of use. And really, it comes down to a lot of pain relief. But again, mood improvement, increasing energy, productivity, focus, alertness, feeling good, but not necessarily wanting to feel high, which we also evaluated for. So when I was at NIDA's intramural research program, we did have people come in who were chronic consumers of kratom, who'd been using it for many different years. And I'm not going to unpack all that because it would take me 2 hours, but I do want to touch on impairment because I don't know if anyone else will. And at least among people who are using whole leaf products regularly, we looked at psychomotor performance, cognitive performance. We did validated driving simulations. Those data are under review. I will just say that we did not observe any adverse effects, nor intoxicating self-reported effects, nor objectively evaluated impairing effects. Now, if you get some average Joe off the street and you bring him in and you give him kratom, I don't know what we could say about that. There could be intoxicating effects, but at least among chronic consumers, we did not see it, nor did we see respiratory depression, pulse oxygen changes, anything like that. And again, these data will be coming out very, very, very soon, within the week, hopefully. So what I'm best qualified to talk about is physical dependence and addiction. And Dr. Volkov touched on this, as did Dr. Henningfield. I've done with my colleagues at NIDA and other institutions 2 systematic reviews on kratom, physical dependence, abuse, misuse, addiction. The terms are all over the place. And there were 55 cases globally that we could include into that study, 40 different papers, 55 individual cases. That is a very, very small number. I cannot stress to you how small that is. Now, do I honestly think that is how many people are actually having some sort of physical dependence, like withdrawal or substance use disorder or addiction with kratom? No, I think it's far higher than that. But my point that I want to make is that the clinical impression that is being made, at least with respect to the published medical literature, is that this is not public health threat number one. I am not minimizing anything at all, but I'm saying that when I go to the American Society for Addiction Medicine conference and I talk to clinicians, I'm not getting the strong signal that this is the biggest problem they're facing. But I do think, as has been said before, we have very, very incomplete information. And I really want to stress that part. When we have assessed for substance use disorder for kratom or kratom use disorder, we don't see high rates of it, but it's not zero, right? And again, there are different symptoms that make up this diagnosis. And I think that's important. So again, mostly mild to moderate, both in this small study and then another study conducted by a colleague at Johns Hopkins, Albert Garcia Romeo, and that study is a few years old now. I think if we were to re-survey people or reassess people, we might see slightly higher rates just because people have been using for longer at this point. So again, not a lot of information, but again, the data that I am aware of, some of which is still under review, we do not have a lot of severity here. I want to also note that not all kratom substance use disorders are equal. So what we have seen signals of are what's defined as physical dependence. So there's tolerance, needing to take more of something to get the same effect, or withdrawal. And we do see craving. We do see some unsuccessful quit attempts. What we don't see in any of the work thus far are psychosocial impairments in daily functioning, giving up important activities, hazardous use, which to me are the hallmarks of addiction and are clinically much more disturbing. I'm not minimizing physical dependence, but again, we have to be really clear about which is which. And with that, I'll just say that again, most kratom withdrawal is mild to moderate. Takeaways: kratom has a strong foothold as a harm reduction tool and is in the chronic pain and recovery communities at this point quite strongly. There has been an uptick in use for all of these other things that have nothing to do with having an addiction. People are using it for, focus, recreational use, for energy predominantly. Um, it is fairly regimented among people using whole leaf products, and we do have tolerance and withdrawal signals. And really, to the person, most people who use kratom regularly do believe that it is more of a benefit rather than a hindrance to their daily living. Uh, Again, the warning: there's a proliferation of new products, and we really, 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 really need to have some regulation around this, given the fact that we don't know what are in any of these products. And lastly, significantly more investment needs to be made in funding. Both give money to NIDA, please give more money to NIDA, and then NIDA can hopefully give money to me. So at the end of the day, give money to NIDA, NIDA give money to me, and that's my spiel. So thank you very much, everybody.